I yield now 2 minutes to the gentleman from California, Mr. Miller.
Gentleman from California.
I thank the gentleman for yielding. What is it about the Republican Party that insists that its mandate in Washington, D.C. is to keep the American public away from affordable health care? First, they start by ending Medicare so that senior citizens who retire will have to pay much more for their health care than they would otherwise. Those on Medicare, because they'll be closed in, an aging population, their health care costs will continue to go up in the future, far beyond their ability to pay. They've decided that they're going to raise the price of prescription drugs to senior citizens. They've decided that they're going to decrease the access of young people to health care by not providing for school-based clinics, health care clinics. They've decided they'd roll back pre-existing conditions that prevent women from getting coverage of health care, young children from getting coverage of health care from life-threatening diseases that they were born with. What is it about the Republican Party that they don't want people to have access to health care in this country that's affordable? They don't mind them being in a lottery. If they can find it and afford it, and maybe they can have it. But if they can't, it's tough. So now we come to a time when they said they don't want one size fits all in Washington. The states should have a right to set up the exchanges. The states have an option. They can set up an exchange or not set up an exchange. Some 49 states have stepped forward and said, we want a right to customize the exchange for the purposes of the people we represent, the nature of our state, the economy of our state, the age of our state. We want to do this. And now they're saying, well, that's good, but we're not going to give you any money to plan to do that. And so what are they doing? According to the CBO, they're now threatening once again the access to affordable health care for 50,000 or more Americans. So they've threatened the access to health care for women, they've threatened the access to health care for children, they've threatened the access to health care for seniors, they've threatened the access for those who are about to become seniors. They just can't stop doing this.
Gentlemen, want another minute?
Just 30 seconds.
Additional 30 seconds.
They want to say, well, they're just repealing the health care bill that was passed. They're just repealing that. No, what they're doing is they're standing in the way. The very same rights that they have as members of Congress to have a federally set up exchange for federal employees where policies pass muster that you get real value if you buy one, whether you buy a health savings account or whether you buy a plan for your family or for an individual, you get real value, you get access. The rights they have as members of Congress, once again, they're stepping into the breach to make sure that their constituents won't have that right at the state level. Because when there are no state exchanges, they won't have that right. It's a really strange view of their obligations to the American public, to working families, to children, and to seniors. And it's a real strange view about their position of privilege that they would have all of this for themselves, but not for their constituents.
Gentleman's time's expired.